So good morning to everyone. Namaste. Welcome to this happy Sunday morning. Welcome to the webinar series Ayush Connect, organized by Healthink Tathastu, along with IGMA, Indian Naturopathy and Yoga Graduates Medical Association. As we all know, in present health scenario, the Ayush systems of medicine, the Indian traditional systems of medicine, is getting a wide popularity. Naturopathy and yoga is a system of traditional medicine, a drugless based drugless system of medicine under the Ayush, like Ayurveda, Siddha, Unani, and homeopathy. Naturopathy and yoga is an equally standardized system of medicine in India. The medical education in India regarding naturopathy and yoga is having a 50 years of history. So today we will be focusing on this whole webinar with naturopathy and yoga medical education in India, its history, scope, and rules and regulations, admissions, etc. Myself, Dr. Vibhas K, Principal of Excel Medical College for Naturopathy and Yoga in Namakkal district of Tamil Nadu. First, let me introduce my panelists today. Dr. Abhay Shankar Gowda, who is a BNYS holder, did his post-graduation later on with MD in clinical yoga and currently pursuing his PhD in community medicine. There is a lot of details to speak about him. I'll just brief about each of them initially. Principal of Maharshi Aurobindo Suharthi College and Hospital of Naturopathy and Yoga in Meerut. Also, Dean of Faculty of Ayush, Swami Vivekananda Subharti University, Meerut. He comes with his vast 20 years of experience in clinicals, academics, and research field. He was earlier. He completed his MD from SDM College of Naturopathy and Yogic Science in 2013. Followed, he was working on close to 15 years there, and he secured his first rank with Siddharam Jindal Gold Medal for his MD. He was a PG guide for MD Yoga under Rajiv Gandhi University of Health Science, and also an examiner for many other universities, including Medical University in Chennai. And he was also a member of National Subcommittee by Ministry of Ayush, Government of India, for developing the uniform syllabus of BNYS across India. Abhay Shankar Gowda. And our next panelist is Dr. Jyoti Nair, who is principal of Annai College of Naturopathy and Yogic Science in Tanjavur, Kumbakonam district of Tamil Nadu. She was earlier served her career as vice principal and professor at JSS Institute of Naturopathy and Yogic Science, Coimbatore, and also with the same position in Shivaraj Medical College for Naturopathy and Yoga at Salem, Tamil Nadu. She's also an NABH assessor and a Senate member for MGR Medical University in Tamil Nadu. Warm welcome, madam. Our third panelist for today is Dr. Apar Avinash Savoji, BNYS PhD. He is the Deputy Director of Academics, School of Yoga and Naturopathic Medicine, SVSA, Bangalore. He is a young and vibrant academician and researcher. Also, he has co-guide for many PhD scholars. So he's basically into the yoga research after his BNYS. He published a fantastic paper on Kumbhaga of pranayama, importance of Kumbhaga on pranayama with its various scientific aspects and mechanisms. So, a warm welcome, Dr. Apar. So today we'll be having an interaction each other regarding various aspects of naturopathy and yoga medical education in India. So let me start with Dr. Abhay. Sir, as I introduced, it's around 50 years of history of naturopathy and yoga medical education. So can you please explain and give our audience some details about the evolution of naturopathy and yoga medical education in India?
Naturopathy and Yoga Medical Education. Thank you, Dr. Vipas. Again, Naturopathy and Yoga Medical Education is there since about 50 years in India. And since 1989, BNYS, Bachelor of Naturopathy and Yogic Sciences, is there in India as a recognized 5.5-year medical degree in the field of naturopathy and yoga, recognized by the Ministry of Ayush as well as now even the University Grants Commission, UGC. Before that,
Yes.
ND, that is Diploma in Naturopathy, was there in the state of Hyderabad at that time. And later on, even there, it was converted to BNYS since 1989. This BNYS degree was first introduced by Mangalore University in SDM College of Naturopathy and Yogic Sciences, Ujire, that is near Dharmasthala, and Dr. D. Virendra Hegdeji, the patron of SDM, the main what you call the person behind starting this course in the early 89 in the year of 89. Later on, now there are about 45 to 50 colleges in India now, totally, which give this BNYS degree, that is Bachelor of Naturopathy and Yogic Sciences degree. Now, Bachelor of Naturopathy and Yogic Sciences degree is again a full-fledged medical degree under Ayush. That is like, see, in India there are about 7 medical degrees. If you want to summarize, that is, one is MBBS, the other is the dental sciences, BDS, and in under Ayush there are 5, that is BAMS, BNYS, BUMS, BSMS, and BHMS. So these are the out of that, BNYS is representing the yoga and naturopathy education, medical education. The medical education in naturopathy and yoga is again, I mean, it is like any other program of medical education, that is 4.5-year degree with 1-year internship, and it is well recognized all over the world as well as in various states of our country itself. And it is one of the unique programs or I mean, medical education programs which gives a blend of modern subjects like anatomy, physiology, the basics of medical subjects, pathology, microbiology, community medicine, and all that. And along with that, the traditional drugless systems of medicine in India as well as the world, uh, all the drugless systems along with the yoga therapy. That's a brief history, Dr.
Yeah. Thank you. Thank you. As you said, it almost started in 1970 as our medical education in India under a proper university curriculum. So that gives a long 50 years of history with evolutions, starting from diploma of 4 years, 4.5 years to 5.5 years BNYS as a full-fledged regular degree program. So later on, even we have MD and other further courses which will come to a little later stages. So let me go to Dr. Jyoti Nair. Madam, with your vast experience in academics, so our audience would like to hear about the course and syllabus and what are the subjects in BNYS curriculum, etc. Please elaborate on the syllabus and BNYS education.
Yeah. Yeah, sure, Dr. Edward. Thank you for the introduction. And now I'll be telling about the syllabus and the curriculum part. So, all over India, we don't have a very similar syllabus or curriculum, but more or less it is the same. So, what is followed in Dr. MGR Medical University, that is, we have in total of 26 subjects, and those are divided equally among different years. So, as Dr. Abhay was saying, the course is of 5.5 years. 4.5 years we have to study in the college, and 1 year is of compulsory rotational internship will be there. So in this 4.5 years, the first year is divided into 1.5 year, and the other, or from second year to fourth year, it is divided into 1 year each. So when you come to the first year, that is 1.5 year, the starting 1 year, the student will be examined for mainly two subjects, that is biochemistry and philosophy and practice of yoga. After that, 6 months, they will again be going to the university examination with three other subjects, that is anatomy, physiology, and PNC. PNC, that is a short form of philosophy of nature care, philosophy and practice of nature care. Anatomy, physiology, and philosophy and practice of nature care are having two papers each. And according to the curriculum, there should be not less than 200 hours of teaching for each subject. Now, coming to the second, this is the five subjects that is taught in first year. Coming to the second year, we have again six subjects, that is pathology, microbiology, yoga, and physical culture one. Then diagnostic method in naturopathy, diagnostic method in modern medicine, and basic pharmacology is also taught there. So, such we can understand that this is a blend of the subjects which is taught in MBBS, but along with the therapeutic subjects of naturopathy and yoga. So now coming to the third year, we have seven subjects, and again we have more of the therapeutic subjects of naturopathy and yoga. So first one is forensic medicine and toxicology. Then comes community medicine. Then there is psychology and basic psychiatry. Then we have also obstetrics and gynecology. Then yoga and physical culture too. Then we have a subject about nutrition and herbology. We have also massage, chiropractic, osteopathy, and aromatherapy. So this covers the entire third year syllabus. Now coming to the fourth year, we are having eight subjects. So that is yoga therapy, hydrotherapy. So this fourth year is entirely, you can say, based upon the naturopathy and yoga therapeutics. So yoga therapy, hydrotherapy, fasting and diet therapy will be there. Chromotherapy and magnetotherapy is there. Physiotherapy, acupuncture and acupressure, which also includes reflexology, Reiki, and pranic healing. Then we have minor surgery, first aid, and emergency medicine. Last, we also teach them about hospital management. So this is about the syllabus that is covered in the entire 4.5 years. The last 1 year is for the compulsory internship, which most of the institutes they tend to make the student get the training 6 months in the mother institution. 6 months they are sent all over the major institutions that is spread out in India. So that is about the syllabus and the subjects that is covered. And when we come to uh, the practical, the mark distribution. So mark distribution is 100 mark is given for the theory aspect. And for the practical, again, we give 70 mark. About in that 70 mark, 50 is given for the oral practical, and 20 is given for the oral. And internal assessment mark also should be sent before the university examination. So that is for around 20 mark we give for the internal assessment, and 10 mark is given for the record. So this is about the syllabus and the examination. When we come to the examination point, so around 15 mark two questions will be there. Then there will be 5 mark questions that will be around 10, 2 mark questions that will be around 10 again. So that comes as the 100 mark question for the question paper. So this is the 4.5 years of study, which includes both, as I told, the subjects of modern medicine as well as the subject of yoga and naturopathy.
If I may add, Dr. Vibhas, to Dr. Jyoti's
Yeah, yeah. Please.
syllabus part. Some of the universities there are some extra what you call subjects like English, Sanskrit, and also some of the what you call value-added courses as per the university. I mean the generalized university rules and regulations, whatever is the UGC recognized universities. So they are optional. Some subjects are optional, some subjects, but the core subjects, what Dr. Jyoti has just now explained, they are overall in all the BNYS colleges. The same subjects are being followed. Maybe sometimes the year of study may be varying sometimes in some universities. Otherwise, the core subjects are all remain the same. What Dr. Jyoti has explained.
Okay. So that brings the whole curriculum as a blend of modern medical subjects as equal to MBBS studies, along with the alternative systems subjects. So see this like naturopathy and yoga as a lifestyle medicine is very much popularizing with stress management, nutrition, uh, energy medicines, and yoga therapy. Altogether, it's a wonderful system with holistic method of approach. So let us go a little bit of yoga aspect. Since yoga and naturopathy is considered as a single medical system in India as of now. So let us go into the depth of yogic syllabus under BNYS curriculum. So Dr. Apar, actually various courses in yoga, starting from 1 month certificate course to different courses under different universities in India. So can you please explain the depth and importance of yogic subjects in BNYS curriculum?
Yeah, thank you, Dr. Vebas, for that question. In fact, if I have to make a difference between the BNYS curriculum and all other yoga subjects, I mean, there are BSc, MSc, and a lot of other curriculum are there. The basic thing here is that there is a step ladder pattern that we follow. We have in the first year, people understand the principles, the basic understanding of yoga. They start from a very basic fundamental understanding. Second year onwards, they will have, in a graded manner, more detailed scriptural understanding as well as the understanding of yoga on human application. So, how do I apply yoga to a special group of people? What is the kind of physiological changes that are associated by practicing yoga? What is the biomechanics of the practice of yoga? So, all those details are there. And then in the final year, they learn about the therapy aspect. So, all this is based on one, the scriptural basis of yoga, second, the scientific understanding of yoga. As we understand today, there are close to 6,000 plus research publications on yoga. And all these are essentially taught to the students in the BNYS curriculum so that they are up to date with what is happening in the area of therapy. Alongside all this theory, there is every day the BNY students across colleges need to practice yoga as practice. So they're trained to undergo yoga practices themselves, and then they are also learning in the process of teaching yoga. And by the time they reach the final year, they are actually imparting the therapy in final year as well as in internship to the patients themselves. So, in a graded manner, you learn from the basics to the most advanced methods that are utilized in yoga. And if you're looking at the volume of syllabus that is covered, each of these years, the theory part is at least 200 hours. And they do yoga every single day, which means they do about 300 hours of yoga practice every year. So 500 hours of yoga every year and multiplied it by 4.5 years of the curriculum plus internship. So we learn more than 3,000 hours of yoga. I do not think any other curriculum in yoga has those details. And therefore, probably what we need to understand is if you want to take yoga as therapy, you should actually consult a BNYS doctor rather than just going to any yoga instructor.
Well explained, Dr. Apar.
Thank you, sir. I think Dr. Vibhas just got disconnected. He is facing some network issues.
It's all right. We can continue with the.
Yes. Jyoti ma'am, would you
Yeah.
elaborate to the audience the admission procedure? If somebody wants to take up BNYS as their career, how
Yeah.
should they approach the colleges and what is the admission procedure?
Yeah, sure, Dr. Rapper. So one thing that I want to stress here is, unlike all the other medical degrees like MBBS or BAMS, whatever it is, up till now the government has not made NEET mandatory for BNYS. So NEET is not mandatory for the admission of BNYS up till now, around mostly all over India. Especially in southern states, it is not compulsory for a candidate to pass NEET. So the admission criteria is based upon the 12th standard marks. Or if the student has passed any equivalent examination other than the state board, then what he has to do is he has to get an eligibility certificate that is issued by the concerned universities to which the colleges are affiliated. Or if in case of a deemed university, so same thing, they have to go for a eligibility certificate. These are for Indian students. But those students who are coming from other countries, or as we know about NRIs, so those interested candidates from other countries should get also an equivalent certificate. The central authorities, they issue an equivalent certificate. So two things are mandatory for the student who is from other than India. Those are equivalent certificate and the eligibility certificate. These two certificates should be, the student should have it before they seek admission to any of the universities or the colleges that gives the BNYS degree. That is about the starting admission part. Now coming to the age. So age limit, the upper age limit still now has not been defined, but the lower age limit is 17 years. So 17 years should be, the child should have completed 17 years of age for seeking admission in any for the BNY course. If he or she has not completed 17 years at the time of admission, at least the year end of the year of admission, and that I mean that by 30th December of the year of admission, he or she should have completed 17 years. That is about the age limit for admission. Now coming to the community wise eligibility. So in a few states like Tamil Nadu, there is a community wise eligibility criteria. So when you see about the general category, they should have minimum eligibility is 50 percentage of the 12th mark. Coming to the MBCs, that is the backward class, we have to they have to secure 45 marks. Then coming to the BCM, first is BC, then BCM 40 percentage. SC/ST community should secure minimum of 35% mark. That is the eligibility of 12th mark based upon the community. There is also one thing I want to tell that this registration should be done before the 2 months after the admission procedure, 2 to 3 months before the after the admission procedure. They should also get registered to the university which the colleges are affiliated to. So most of the colleges themselves help the student to get registered after the candidate seeks admission in their college. So that is about the admission criteria and admission and procedures that is followed in most of the colleges all over India. So, Dr. Abhay and Dr.
Okay.
Abhay, because they are in two different.
Yeah.
If
Can
they
I
want to
just
add
add a
something.
few things, Dr. Jyoti?
Yeah, maybe Dr. Abhay can add on to that.
Yeah.
Yeah.
See, the UGC recognized private universities, if at all we are speaking about, because the most of the medical universities are government run. So that is a overall rule for all, because that is affiliated colleges. If they are colleges under a particular university or a private university, then a slight difference in the rules and regulations is they are bound to have a entrance exam, that is a national entrance exam inside the university. I mean, the university conducts a national entrance test, and through that test the students are coming. And normally, as Dr. Jyoti said, it is about physics, chemistry, biology, 50% with the intake. And some of the universities also, age is not a 17 years of age is not a bar. Even up to 16 years also they do take. Okay, and I mean slight changes state wise and the state government rules and all that. So that otherwise the universities also otherwise almost all like what Dr. Jyoti has said, the general rules remain the same. One thing is NEET is not required at present. Since last year, NEET is not required. It has been removed for BNMAS courses by the Ministry of Ayush itself. That is one thing to be noted.
Okay, thank you for those wonderful explanations. I think even Rajagandhi University in Karnataka also conducts an exam for BNYS in Karnataka. Over we have around 45 BNYS colleges, which imparts the degree in naturopathy and yoga in the country. So there may be some differences regarding the admission procedures, and the universities depends on the state level. But almost we understand that it's after +2 with a minimum of 50% depends on the community reservations. So that is the basic rule for getting admission into a BNYS course. So interestingly, actually we have a women's only college, only for girls in Bhopal, Sant Hirdayaram Medical College, which admits only girls into BNYS studies. So that's an interesting factor. So, Isaacs, basic because regarding admissions. So now, what after BNYS, after completing this piece and after 1 year regular in let us go to the level of higher studies. What are the options for higher studies after BNYS? So, Dr. Abhay, since you have completed from first MD, Doctor of Medicine in clinical yoga, I would like to ask you to please expand what is the scope for MD and what are the curriculum for MD and how many colleges provide this MD in India, please.
Before we go into the scope of MD, let's just have the scope of BNMAS first. What a BNMAS graduate could do. I think that would be right. We go step by step. First, let's know about BNMAS, and then I will brief about the scope of MD programs also. I hope you don't mind, Dr. Vibhas.
No. I just thought of explaining number of colleges and this one. Further, we can take up the scope also because we have framed it.
Okay, for post graduation again MD program. We are specifically talking about MD program. Then in Karnataka, about 2 colleges are giving the MD programs. In Tamil Nadu, 1 college, the government college, and in Bhopal, as you said, the only girls college, they are providing MD program. And also in our university, that is Swami Vivekananda Subharati University, we are providing the MD programs. There are about 4 streams all over India. That is MD Clinical Naturopathy, MD Yoga Clinical, MD in Acupuncture and Energy Medicine, and as well as MD in Nutrition and Dietetics. That is Naturopathy, Yoga, Nutrition and Dietetics. These are the 4 major programs which have now been started as MD programs in India. I don't know, Dr. Apar should add if there are any other MD programs in S. Vyasa University, Bangalore.
S. Vyasa does provide MD in yoga, and BNYS is definitely the eligibility.
Yes. So these are the main 4 streams of MD programs which are done. I mean, usually by naturopathy and yoga colleges, which provide even BNYS as well as these MD programs.
Dr. Abhay. Now, like every undergraduate program, the student may aspire for something higher always. So even regarding BNYS, there are so many BNYS graduates working in India and abroad. They did so many other courses after BNYS other than the MD. So, for example, there are so many post graduation programs like MSc and other programs. So I would like to ask Dr. Jyoti, madam. Madam, can you please uh, give few options other than this MD of other MSc programs which a BNYS graduate could aspire for?
Yes, Dr. Vibhas. So first and foremost, the student who has passed BNYS, they seek to do some MD, or other than that, they can also do MSc. So the first preference may be for MSc Yoga. So there are few institutes that in India, those which provide MSc Yoga. So few of them I'll just name. So one is Swami Vivekananda Yoga Sandhana Sanstana, Bangalore. Yes, Vyasa, Bangalore. Then there is SRM Institute of Science and Technology, Chennai. There is Annamalai University, and which is in Chidambaram, Tamil Nadu. The one more is Ravindranath Tagore University, Raisen, Madhya Pradesh. University of Madras, Chennai. Then there is also a university in Kerala, Kasargod, that also gives MSc Yoga. Other than that, there is a Chettinad Academy of Research and Education, that is in Tamil Nadu, that also gives MSc in Yoga. So these are only few main institutes that I have named. There are many other universities and institutes that offer MSc in Yoga. So next MSc program that our BMS candidate can opt for is in MSc in Anatomy, Physiology, and Microbiology. So this base is particularly based upon the preference or the choice of the candidate. So what which career they want to choose. So first thing if they're liking is towards yoga, they can go for the first MSc yoga programs that I told you. Other than that, if their field of interest is towards academics, like teaching profession they want to come into, then they can take up MSc programs in anatomy, physiology, and microbiology. So these are very much available in many states. Mainly, it is in many colleges are offering this anatomy, physiology, microbiology MScs to BNYS candidates in Karnataka, Tamil Nadu, Maharashtra. For example, University of Madras, Kasturba Medical College, Manipal, Sri Ramchandra Medical College, then MS Ramaya Medical College, even JIPMER, Jawaharlal Institute of Postgraduate Medical Education and Research Center. All these are also major institutes that offer anatomy, physiology, as well as microbiology. Then, other than MD PhD, they can also go if they are having interest towards clinical research. They can go for MSc or PG diploma in clinical research. So there is a well-renowned university, Cranfield University, that is from UK, but it has various branches in India that also provides MSc in clinical research. So if the candidate has an apt or an interest in clinical research, he can definitely go for this. So after this MSc program on clinical research, he can work as clinical research institutes in various organizations that are involved in research activities, which can be funded by ICMR, CSIR, CCRAC, or DST, anything of that sort. They can also go for PhD after doing this MSc courses. If the students interest is in management, then they can go. They don't want to go into the pure clinical side. They don't want to go into academics, but still they want to be attached to any health sector. So they can go for MPH, that is Masters in Public Health, or they can go for Masters in Health Administration, that is MHA. They can also go for MBA, that is MBA in Hospital and Healthcare Management. So these are in high demand if they want to work in healthcare sector. There are also short duration courses which the candidate can add up to polish their career. So those are like diploma courses in sports medicine, disaster management, preventive and promotive healthcare, masters in personal management, etc. So these are also very good options if they are opting for MSc or any other higher studies. There are few other additional short-term courses which I want to include. So those are short-term courses in dietetics, they can do counseling, like psychological counseling is also given as a MSc program as well as a diploma program. They can also go for postgraduate diploma in emergency medicine, which are given in modern hospital, modern tertiary hospitals. For example, it is given in Hinduja Hospital, Mumbai, or also in Ruby Clinic, Pune. So many institute they offer postgraduate diploma in emergency medicine. So these are few of the alternatives that a BNYS passed out graduate can go into, other than MD or going straight away before PhD. They can choose any of this and then go to the PhD. So, Dr. Vibhas, I think most of the courses that a BNY's candidate can go and join, that I have completed. If anything else
I,
is there, I would ask other two
yeah,
panelists to add.
I
Yeah,
think
thank you.
I just wanted to add a couple of things there, madam.
Yeah.
Uh,
Yeah,
there are a few courses available in several universities in UK, United Kingdom,
yeah,
for which BNYS has been eligible. There is master's program in diabetes, which is available in Nottingham University, Manchester University. A couple of people have already completed it and they have carried on from there. And a couple of my students have joined there now. There is also masters in psychology in many of these UK universities for which BNYS is eligible. All they need to do is a little more documentation. They need to connect with the college. The college will have to give a recommendation letter. But definitely, if you want to study abroad, BNYS can be a stepping stone as well. Abhay sir, if there is anything missed
Very
out,
good. That's a
Okay,
wonderful
you both have
explanation.
you both have wonderfully covered both the I mean all the aspects of it.
thank you.
Yes, yes, yes. No, it's a very good career track which you have shown to our BNV's graduates, those students participating in different colleges all over India. Thank you for that wonderful explanation. So, and we know that under our academic curriculum, PhD comes as the highest option. So, I would like to go back to Dr. Abbar to explain, since he's a PhD holder already from SUSI University. What are the options for doing PhD after BNYS or after this BNYS? Which are the institutes in India that provides these options for a BNYS graduate?
Okay. Thank you so much for that question, Dr. Vibhas, because research is something that many fresh BNYS graduates are passionate about. And of course, PhD is the best option for them. Some universities did offer admission to PhD directly after BNYS. In fact, SVASA also used to offer PhD soon after BNYS. These institutes include All India Institute of Medical Sciences, New Delhi. So there are already 2 or 3 people who have completed their PhD work under the Department of Physiology and the Center for Integrative Medicine and Research in All India Institute. And there are other major institutions like National Institute of Mental Health and Neurosciences, NIMHANS, which has offered PhD in neurophysiology. There are people who are doing it. There are people who have completed their PhD from the Department of Psychiatry in NIMHANS. So SVASA is one option where a lot of people have already completed their PhD work following BNYS. Rajiv Gandhi University recently have started after MD. People can enroll for PhD in yoga or naturopathy. There are 2 streams available over there. Of course, as I know, Savitribai Phule, Pune University is offering a PhD to BNYS graduates, and there are a couple of people enrolled there. So Bharati University, I believe, also is offering, if I'm not wrong, Abhay sir?
Yes, community medicine for
Yes,
BNY after MD. After MD, of
yes,
course, not only just BNYS. After
yes.
MD, community medicine is open now.
So now what is there is it would be based on the university's guidelines. Uh, each university can have their own methods of looking at it. Some of them do enroll people directly. Some of them will require masters as an eligibility for PhD. But then also BNYS is an eligibility for UGC net qualification. So you can give net qualification and enroll for a PhD program, or as a JRF you can join. So there are multiple avenues available, and there are several universities now offering different kind of courses in terms of PhD.
Okay. So that gives altogether a very good understanding of higher studies options, various options, starting from MD in 4 streams. There may be about 10 to 15 MSCs as per graduation, which a BNYS could acquire, and even up to various options of PhD in India. So immediately after this, like any other doctor in any other streams, whether it is an MBBS or uh, other Ayush streams, like a doctor will think of medical registration. So before going to the vast scope of BNYS, let's have a brief word about registration in the country. Dr. Amay, can you just expand that different options in under different states regarding the medical registration, please?
Yes. Medical registration for BNYS degree holders is about in 16 states of India. It is available right now. If I have to name them, Andhra Pradesh, Karnataka, Tamil Nadu, Madhya Pradesh, Jammu and Kashmir, Chhattisgarh, Rajasthan, West Bengal, Assam, Goa, Telangana, Kerala, Manipur, Pondicherry, and Andaman and Nicobar Islands also. I think these are about 15, 16 states where BNYS registration is already being given. Some of the states are in the process of starting it. Some activities in the government, Ayush Ministry of Ayush Department of States, the work has already started in some of the states. But otherwise, these are the 16 states which are providing BNYS registration for the graduates. There was a phase of central registration also. The Ministry of Ayush Government of India had given the authority to CCR1, Central Council for Research in Yoga and Naturopathy, for BNYS registration. That is central registration. A central register was maintained there. The person would apply online, and then they would get the central registration. Presently, it is on hold due to some technical reasons, I believe. I am not sure. Presently, it is on hold. Otherwise, even CCRYN was given the opportunity or the facility of where BNYS people could register centrally through Ministry of Ayush, for the Ministry of Ayush Government of India. And of course,
Okay.
there are newer states coming up with registration statuses. Very soon we may get updates on the other states also. These 16 states have definitely have statutory regulations available.
That's true. Like in Tamil Nadu, we used to say, as soon as you come out of the college, you will get a medical registration ID card with you, so you can out a registered doctor. Same way, as you said, it's a wonderful news that around 16 states in India have medical registration, including a central level registry under CCRYN. Thank you for that information, Dr. Abhay. So I used to say to my students, like, I cannot say good morning in my classmates WhatsApp group. In my BNYS classmates WhatsApp group, I cannot say good morning, because most of the time, for some it may be good night, for some it may be good afternoon in different countries. So BNYS gives a good scope, not only in India, even in America. So before going to the details, let us take it step by step, part by part. And since you all three are experts in different fields after BNYS, so let me ask it in a separate sections regarding the scope after BNYS, because naturopathy and yoga medical education for still it has to reach to a mass into the public in India. Though in particular states which have around 10 medical colleges, though it is famous, still some of the states are not having very, and this information, what is the scope after having a yoga and naturopathy professional medical education will be very much interesting to our audience. So uh, I initially I divided as clinical and of academics and research, tourism and wellness, etc. We know like multitude of options after BNYS. So first, Dr. Abhay, can you please expand the clinical scope after BNYS? How a BNYS practice as a doctor? What are the benefits for the common public through that medical practice? What are the options in the clinical practice? Was it clear? Hello?
Because we were not able to like. Apar, can you just update me what Vibhas has
Yes,
said?
sir. Yes, sir. Dr. Vibhas was discussing about the scope after BNYS, and he wanted you to elaborate on the clinical dimension of it. What kind of clinical practices a BNYS graduate can get into, and what kind of scope do they have?
Okay. Okay. Due to the network, I was not able to hear. Okay, the basically when a BNYS graduate comes out, he is now fully trained as in his 5.5 years of the education, and then the last year of internship. He is now a full-fledged doctor. First of all, we should know that a full-fledged doctor with all the medical basic medical sciences information, the advanced medical science information, as well as the clinical management of various diseases and disorders of the human system. Now, he can open his own clinic, that is, as a general practice, he can start his own clinic where he can practice naturopathy and yoga by consulting the patients directly. One, he also can have minimum infrastructure hospitals of his own in the initial stages. If he is able to afford, then he can also have larger hospital. That's also one of the thing. And also there are government and private opportunities as a medical officer or a clinical practitioner or a consultant, naturopathy and yoga consultant. There are private as well as government opportunities as a clinician. Now, other than this, also there are consultants or physicians in National Rural Health Mission (NRHM) under Ayush in some of the states of India. They are also taken up as consultants in naturopathy and yoga hospitals. Large naturopathy and yoga hospitals exist in various parts of our country, and here there are a lot of opportunities because a single hospital, maybe let's say for example a 100-bedded hospital would require about 15-20 doctors. So a lot of opportunities there. A lot of new naturopathy and yoga hospitals also coming up, and the old hospitals are also already there who constantly require these BNYS graduates, as well as the government setup. That is, in Karnataka, I know of a private-public partnership between the government and SDM college. Also, I think there are postings of BNYS candidates there in wonderful what you call government opportunities in the state of Tamil Nadu. I think about 1,500 BNYS graduates are all over Tamil Nadu. I think Jyoti could let me know if that is the right number or what I'm talking about. Or Dr. Vibhas also can update about that. I think a lot of government opportunities in the state of Tamil Nadu. Even Andhra Pradesh, a lot of government doctors. Even for the COVID management, naturopathy and yoga is considered to be one of the best ways of what you call clinical intervention. And in Tamil Nadu, they have proven that, they have shown that, and now even in I think Telangana, they are appointing in Karnataka. They are appointing for COVID management naturopathy and yoga physicians.
Okay. Thank you, Dr. Abhay. So, which means as a doctor, maybe a little bit of for the benefit of public who are watching, other than the community, the NS community, shall we little expand on what type of diseases are treated by these doctors? So, I would like to just ask Dr. Judy, Madam, can you please explain what kind of diseases and what group of diseases may be treated by these DNYS graduates, please?
So, Dr. Vibhas, I would like to say this BNYS doctor, naturopathy and yoga doctor. I preferably like to call them as lifestyle doctors. So, by the name itself, we can understand we are the people who teach the person who approaches us for any condition. We are the person to teach them a new lifestyle. I do not mean by saying that a new lifestyle is entirely different from what they are following, but some minor modifications in the already existing lifestyle that they are having, that may be based upon the region they come from, the religion that they follow, or some other faith that they may be having. But to be very precise, we are lifestyle doctors. So the major main diseases that are treated through naturopathy and yoga or through lifestyle intervention can be named as lifestyle diseases. So most of the diseases now are turned out to be a result of some faulty lifestyle. So we can include like diseases of the endocrine system. There are various number of diseases that fall under endocrine system, like you can say when you take about a woman, you can say about PCODs, you can say about fibroids, you can thyroid is there, obesity is there, and when male and female both, when you consider there is diabetes, there is the hypertension, and many more. So these are all lifestyle diseases which can be treated very well through naturopathy and yoga. These are only few that I have told. Bronchial asthma is there, psoriasis is there. Psoriasis like diseases find very less treatment in different other system of medicine. But through naturopathy and yoga, we can definitely give them uh, near about 100% result. This because some of the diseases are, we say they are psychosomatic. But in other system of medicine, the psych part is not given much importance. But in naturopathy and yoga, as we give equal importance to the tan and man, that is the body and mind. So this type of diseases can be cured very well through naturopathy and yoga. So these are few diseases that I have named. The most of the diseases can be treated. Like you can, just an example up till where we can reach. Cancer is also a disease that I do not say that we can cure cancer, but in second stage of cancer also you can help the patient to come back to the normal stage. In the fourth stage, it may be difficult to treat only with naturopathy and yoga, but definitely we can give a lot of relief and we can extend the lifespan of the patient, cancer patient through naturopathy and yoga. So there are really a wide number of diseases that we can treat with naturopathy and yoga. Osteoarthritis is there, rheumatoid arthritis is there, psoriatic arthritis, or even gouty arthritis can be managed very well through naturopathy and yoga.
Thank you, Madam. Dr. Thakur, anything to add on that with your yogic perspective?
So,
Anything to add on that? Treated?
I always quote this. I always do tell that there are some limitations also for our naturopathy and yoga treatments. Like along with like every system of medicine has its own limitation. Like for example, a lifestyle disorder like diabetes or metabolic syndrome does not have any permanent cure or solution in the any other system of medicine. But naturopathy and yoga with the right lifestyle modification can give a drugless method of managing these diseases. The same way, naturopathy and yoga also has some limitations, like acute conditions or acute emergencies, or maybe immediate road traffic accident or something like that, would require the necessary services of an emergency healthcare unit or something like that. There we are a little helpless, but otherwise rehabilitation we are very good at. I mean, rehabilitation of post-surgical cases also, maybe post-cancer treatment also, very good at. This aspect, I mean, and infectious disease, some of the infectious diseases, but that has been now disproven, because there is a study on tuberculosis where yoga and naturopathic lifestyle was given, and it was seen that tuberculosis patients recover faster than just taking the what you call RNTCP regimen of 8 months or something like that. The recovery is faster when yoga and naturopathy is included along with the RNTCP regimen. Now, the COVID management in Tamil Nadu has already shown us that there is no what you call better thing than naturopathy and yoga, because see the protocol, all the protocol set by WHO or the government of India is being followed for all the patients in COVID management. But as a special additive, as a special what you call supplement, let's say naturopathy and yoga was added in Tamil Nadu, and a trial was done. But now the results show that yes, there is wonderful what control as well as the recovery of the COVID patients in Tamil Nadu. It does show that naturopathy and yoga is also now beneficial in infectious diseases, because see, without evidence, without proof, we don't talk. PNMS doctors, that is one of the most advantageous thing, that we are evidence-based teaching, evidence-based clinical practice, and we are bound on creating evidence, that is through research continuously. So that's how I mean, now we are confident enough to tell that no disease can have, I mean, we do not have any limitation actually. We can take care of anything except for the acute emergencies, or RTAs, or head injuries, or accidents, or where acute emergency care will be required. I think Dr. Apar was thinking of adding something.
Yes, sir. I mean, when you said infectious diseases, I just wanted to talk about an initiative by National Institute of Naturopathy. Also, SVASA has done some work on HIV patients. NIN Pune, which is a government of India's autonomous body, has started HIV sanatorium in the year 2010-11, and they have been taking care of these HIV patients who are on ART drugs. And what is seen is, if you have this yoga naturopathy lifestyle as an add-on to the conventional medical treatments, the quality of life is going to be enhanced, which is a major problem today. The moment I know that I have such a problem, my psychologically I will be down, and that is where probably yoga and naturopathy can be a great add-on. We have done some studies on yoga and HIV with SVASA University, and the results are fantastic. The immune system gets boosted up when you are relaxed, and this is a known fact across the world. So, therefore, I would definitely second both of my other panelists that there is no limitation to naturopathy other than probably acute management that would require emergency care.
Just one more thing to add, Dr.
Good.
Vibhas. Depending on these
Yes, yes,
discussions
please.
with Apar also, I think the most what do you call easily integratable, I mean, sorry,
Absolutely.
integrative medicine, what we call as, is naturopathy and yoga. You take allopathy, you take Ayurveda, you take homeopathy, you take Siddha, you take Unani, and along with that, if you want to add yoga and naturopathy, absolutely no harm, and the results are double or better than what the individual systems can give. So it is a unique what you call feature of naturopathy and yoga. It doesn't cause any drug interactions, doesn't cause any or absolutely zero side effects, and along with that, it goes along with all these systems of medicine. Of course, standalone therapies in yoga and naturopathy are also very helpful, but integrate, if you want to integrate and have a holistic approach also, then we are not behind, and we are the best integrative medical system available and possible.
And that is why I think I would just say that we are good at prevention, we are good at management, and we are good at rehabilitation of the problem. So all spectrum of disease management, and not just disease management, but also to promote health, we are good.
Promote, yes, prevention of diseases also we are there, and also all age. I mean, some people say that the children cannot practice this thing. No, nothing like that. Children can practice, middle age can practice, older age can practice. There are a lot of studies where have shown that in old age most of the problems can be managed by dietary, what you call, management, as well as psychological counseling. So many other things which are drugless, purely drugless. Yoga, I mean, lot of studies already shows that the elderly people do get benefited with regular practice of yoga and naturopathic style of lifestyle.
So maybe because of that easy adaptation for integration of with the different other systems of medicine, like for example, even in Tamil Nadu, as you said, during this COVID-19, like every medical college, like 29 medical college in the state of Tamil Nadu is having a unit of yoga and naturopathy department and appointed a BNYS doctor there. So in allopathy medical colleges, they're running naturopathy department, and even in each and every COVID ward, our BNYS doctors are appointed to treat through yoga therapy, aromatherapy, steam inhalation, and sun bath, and so many other naturopathic measures. So that's a wonderful example for this easy adaptation for integration. So not only that, I think as a clinical scope, even so many BNYS doctors are working in different units of AIMS, like top class specialty hospitals, even up to oncology hospitals in India. So take any field, maybe clinically, a BNYS doctor can be appointed and get his service. So that's a wonderful overview of clinical exposure, clinical scope for a BNYS graduate. Thank you, all of you. Now let us go to the academic scope of BNYS. So I would like to ask Dr. Jyoti Madam, like madam is having more than 50 years of teaching experience in various institutes across India. So what are the academic options? Like there are so many new medical colleges coming up. So obviously there should be a lot of demand for a BNYS graduate in the teaching field. So can you please say a few lines on that?
Yeah, definitely, Dr. Vibhas. Initially, when a fresh graduate of BNYS passes out from the college, so they can join any academic institute or colleges as a tutor or lecturer. So, as a tutor or lecturer, that is without any year of experience. After 3 years, they become assistant professor. So, 3 to 5 years is they will be working as assistant professor. Five to after that they will be promoted as associate professor. So 5 to 8 years of experience, they are the associate professor if they continue in the same academic field. 8 to 10 years, when they have experience in the same academics, they will be promoted as professors. After a span of 10 long years, any candidate with BNYS is eligible to head the institute as a principal or a dean, whatever. So they require a year, 10 years of experience to head any of the naturopathy college. So previously, this is about a BMIS graduate who has just passed out. But if they complete 3 years MD, like Dr. Abhay was saying, so they can join straight away as an assistant professor. So they need because the MD that they are doing, that is considered as 3 years of experience. So after BNYS, when they complete MD, this 3 years is added upon for their experience, and they can straight away join any institute as an assistant professor. So that is about that. And previously, as I told about MSc and all those things, so they can like if their area of interest and their choice of MSc is anatomy, physiology, biochemistry, etc., microbiology, they can join even other Ayush institutes teaching anatomy, physiology, or anything. They can join in the same criteria, and they can develop themselves as assistant, associate, and professors. So that is about the academic growth that they can have after having a BNYS.
Yeah. Thank you, madam. Now, we used to hear a lot of BNYS doctors as spa directors, spa management, and earning a very good amount to fill their pocket. So, Dr. Appa, can you please explain the tourism and wellness industry, which is very highly booming and highly doing their service in the world scenario. So, what a BNYS graduate have role as the role in career options as a in wellness and tourism industry?
Yeah, Dr. Vibhas, the whole world is now shifting from illness to wellness. And that is where probably our health promoting measures that are there in yoga as well as naturopathy as a lifestyle come in picture. Most of the five-star hotels, the big hotels, do have their own spas where they would require spa managers. So BNY's graduates can directly get into these. If I have to name a few, probably Taj, Westin, Shangri-La, big names in the industry, uh, Hotel Leela Palace. So in fact, some of the BNYs have pioneered this entire field. In Bangalore, Hotel Leela Palace, which is a seven-star hotel, the spa was created, designed by a BNYS doctor himself, who also executes all the things over there. So, there is this big hotel industry which is there. Of course, there is tourism industry. A lot of BNY's doctors go to cruise ships, which are traveling transatlantic between the North American continent to Europe. And a lot of my friends are there who travel in the cruise ships, work there as acupuncturists. A lot of them are working with the Southeast Asian countries where you have Malaysia, Thailand, Bangkok, all these places, they work as the spa managers. And British Virgin Islands, they have established themselves into. So a lot of places across the world, people are looking for wellness and tourism. Also, the spa industry is booming. And also, this is an industry which can be uh, said as the money getting industry for a BNYS graduate. So they can have a lot of income utilizing these contracts.
Thank you for that good information. Uh, it's like we have, in my mind, some of the examples comes like one of the best health destination, health spa destination as Atmantan Wellness in Pune. Also, it's already established. A newly upcoming one, just like in Kerala, uh, 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 one of the BNYs is said. So all these good health destination as tourism destinations because they mix it. It is not just kind of a massage they go there. They are now people are going for a holistic health to obtain. Even they are ready to do fasting in a health resort under the spa directors. So that kind of deviation is happening from, as you said, from illness to wellness. So BNWS graduates are having a wonderful opportunity in that area. Thank you. Uh,
Dr. Vibhas,
Dr. Abhay?
yeah,
Yes.
I just want to add a few things. The health cruise,
Yes, please.
I think, Dr. Apar, health cruises are there, which are like large ships which take for a vacation from 3 months to 6 months of vacations or shorter vacations also, which have the most preferred doctors on these health cruises are BNMAS graduates. They have already certified them as one of the best doctors, and they prefer them because of their very what you call professional attitude in such an what you call international environment, as well as the various therapies which we could execute there, like the most important things like acupuncture, manipulative therapies, massage, and what you call yoga therapy. We are like the best made what you call package for them to manage their health aspects on the health cruises also, as well as some of the software companies are appointing BNS graduates as what you call health consultants or stress management managers in their companies permanently. Like they are always there. They are given an office there, and anybody has issues, problems, they can go and talk to them in the IT companies, because IT companies have been known to be very, very stressful and all that. And even some of the corporate offices also do have BMS graduates appointed solely, okay, for managing their health needs of their what you call officials.
Good, good. That's a very good information. Now I would like to go to Dr. Jyoti, madam. Madam, you will have had experience in the government sector regarding since you have worked as government Ayurveda district hospital in Kerala. Like, what may be the other government opportunities other than all these? Maybe like we have NIN, CCRY, and different national institutes. And so, can you please expand a bit on the different government opportunities, sometimes selection process regarding BNYS graduate?
Yeah. So I had the opportunity to work with Kerala government under ISM, that is called as Indian System of Medicine. So each state has their own names in which under which they appoint BNYS doctors. So when you come to Tamil Nadu, the number of appointments and the number of doctors who are working under government sector are huge. Can say that. So in general, all over India, the BNYS doctors are appointed under NAM. NAM is one thing, National Ayush Mission. Then NRHM is there. Then even Ayush clinics are there. Ayush clinic that involves all the integrated the systems of medicine under Ayush. So, along with other doctors, even the BNYS doctors work in the Ayush clinic. That is one thing. Then another, other than that, there are also wellness clinics. So in Tamil Nadu, the practice is there of wellness clinics where the naturopathy doctors are appointed. There are also lifestyle clinic. So lifestyle clinic also has naturopathy and yoga doctors under government sector. There are also taluk hospitals. So taluk hospitals also have a department, a separate department in their hospital which appoints naturopathy and yoga doctors. There are PSCs, there are ESI hospitals which have separate department for naturopathy and yoga where our doctors are appointed. And there are additional specialty centers. Few additional, other than all this what I have told, additional specialty centers are there where our naturopathy and yoga doctors are working in many states, especially in Tamil Nadu. This boom is very much seen in the government sector. Then there are a lot of there are few research center in the international level. Research center are coming up, especially in Tamil Nadu. Multi-crore international this research institute is coming up, which will definitely have a big opportunity for the BNYS candidate to work in the government sector. So these are few of the arena in the government sector which the government is promoting and where the BNYS graduates can find an opportunity. So the salary part also, when you see it is mediocre to high level. And in Tamil Nadu, the mode of getting into this type of jobs are through different things. So one is through the 12th marks, and then the personal interview. Then another thing can be by writing MRB, that is Medical Recruitment Board. They are conducting exams through which, according to the rank list, the candidate can get the jobs. In states like Kerala, PSC examinations are conducted. So based upon the rank list, there are some hospitals which are permanent, which have permanent doctors. So for that, PSC examinations are conducted in Karnataka, in Kerala. So through that also, the candidate can get into this government job. So the scope is huge, but the student should become competent. He should make himself competent for all this examination is what I would suggest.
Absolutely, Dr.
Okay.
Jyoti. Competence is very, very important.
Thank you,
Knowledge,
ma'am.
skills, and competence.
Right.
There's a lot of scope. Lot of scope, Dr. Vibhas. You also know this. But unless and until the student is regular, the student is knowledge, the student is skilled, he has practical knowledge, and then the communication skills required for that. Uh, then, then only it will be possible that he would be appointed in such places, and then he would also have a very good package or something like that. But without these things, definitely they any field, of course, not only in a BM as graduate, in any field it is the same. The one thing which I missed in the private, what you call aspect you had asked, that is private practice aspect, is nowadays some of them have specialty clinics. Like they are simply practicing acupuncture, or they are simply practicing nutrition and dietetics, natural nutrition and dietetics, or disease-based specialty clinics. Only obesity. I treat only obesity. Otherwise, nothing like that. I mean, specialty clinics, or only pain disorders. That is pain clinics, or they are headache clinics, stress clinics, allergy clinics, lifestyle de-addiction clinics, just lifestyle management clinics, back pain, or what you call diet counseling and rehabilitation clinics. So specialty clinics, a small part, or I mean, they are doing some I mean, special courses, or upgrading their knowledge, or working in some such places, and then they are doing these specialty clinics also, and which is very, very effective, and a lot of like scope for that also, a big queue for these specialty clinics also.
So I would like
Very,
to
very,
add to
very
Dr. Abhay's point. So, like many of our fellow naturopaths are now also having natural birthing centers. So they are dealing with
Yes.
yeah. So that is a very beautiful concept. So they allow the woman to have the natural birthing. They give the full support in the entire period of pregnancy. Later on, even the family member can they can accompany the woman who is going for birthing, natural birthing. So that concept really has a lot of attention from other system of medicine too, because give natural birthing nowadays has become so rare when you go to other system of medicine, but we are able to provide that to the public. That is really a great achievement in yoga and naturopathy, I would say that.
very good. Very, very informative knowledge that is provided to our viewers. Dr. Appar, we have already mentioned about research and its opportunities, etc. Still, can you add few more lines regarding the job opportunities or as a career option as a researcher for a BNYS graduate?
All right. I mean, I think I will add on to what Jyoti Madam was just talking about. There are these major research organizations. We keep hearing about All India Institute. We keep hearing about National Institute of Mental Health and Neurosciences. There is NIBR, National Institute of Brain Research. So all these institutions are now taking up yoga research specifically, but in all Ayush research across. I know for sure that AIMS Rishikesh has a yoga naturopathy physician. I know for sure that AIMS New Delhi has a yoga naturopathy physician. I know for sure that NIMHANS has a center for integrative medicine where there are BNYS MD graduates appointed. So that can be a contractual position based on some projects, or it can also be a permanent position. Say the Ayush physician position in AIMS is a permanent position, whereas there can be projects, research projects, which will come up time and again. And once you are into an institute, you would always know that a newer project is coming up. You can get close to the professors over there and then learn from them, and that can be a huge stepping stone for individuals. I know one of my students who is doing his PhD from the CIMR AIMS New Delhi went there as a JRF, worked under a project, and now the project investigator liked him so much that he has taken him as a PhD student himself. So that can be a stepping stone, and then you can grow from then on. CDC, Center for Disease Control, conducted a huge project on heart disease rehabilitation, people with cardiac rehabilitation, yoga being the main line of thing. And one of our colleagues, Dr. Chandrasekharan, was coordinating the whole event. So there are these many opportunities that are coming up with research. Of course, there are CCRY and there is NIN, which is taking up a lot of research now. There are institutes like SVYASA. So I think there is a big scope for people who are interested in making yoga and naturopathy as an evidence-based system. So I think Dr. Vibhas got disconnected.
There are a lot of research opportunities also in the field, in the I mean, BNYS naturopathy and yoga colleges also. There are research
Absolutely.
wings set up. Other than that, there are a lot of other what you call corporate hospitals who want to do research, like I know of people in corporate hospitals have holistic department or integrative medicine department who are in collaboration with naturopathy and yoga physicians doing a lot of research studies, maybe in orthopedic disorders, maybe in cancer. I know of a cancer study with the world's best, what you call, Cancer Institute of America, along with the HCG hospitals in India, which is I think it's a very large project. We are, funded by the NIH and all that. Wonderful projects are going on. Along with BNYS people. So research is definitely a wonderful prospect for a BNYS graduate. As well, I think they are also research oriented also. They are trained for research methodology and all that.
I
During their
don't think any other medical course has dissertations in their undergraduate levels, sir. So BNYS is definitely something unique that way.
Vibhas is back.
Hello. Yeah. I'm back.
Yes.
See, we have just one or two questions which I have seen from our audience. One is which college is closer to Bihar or Jharkhand? I don't think directly in Bihar we have a BNYS college, so we may be able to guide them. Dr. Abhay, can you guide them like which may be closer to Bihar?
I am here in Meerut. Subharti University, Swami Vivekananda Subharti University, Meerut is one option for them. There are a lot of students from Bihar also, very intelligent students, very wonderfully. They are in their now third year, final year, doing their what you call BNMAS degrees here. Other than that, I think Bhopal is, if they are. Bhopal College, see, I cannot just say about my college. Bhopal College is also another college for them as an option. But one limitation in Bhopal College is, again, it is only a girls' college. So, because if it's a girl student, then they can go there. Otherwise, I think we have both boys and girls we take here in Bharati University. There are other colleges also, which are coming up just now. There are newer colleges also which are coming up. You can have a list of all that. You can contact us later. Not a problem. Anytime. Our contact numbers are on our websites and they're available. Definitely, we will guide you, all the students, about like whatever is best suited for them. We will definitely guide them. Not a issue.
Same way, we had one more question regarding what after engineering. Is there any scope of studying BNYS after completing an engineering degree? Madam, can you please give him some direction?
It's a very vague question.
Definitely, because I have a candidate in my first year who is a BNYS guy, who is an engineer himself, but he had this liking towards naturopathy and yoga from the beginning. Because of some compulsion, he did this engineering course. But I would say it very clearly, both are entirely different streams. After doing engineering, there is no advantage that you get through engineering while joining BNYs. But definitely the career choices are entirely different, the job opportunities are different. After doing BNYs, you become a doctor, you can treat patients, and all the scopes that were told to you by our panelists, you can get all those things. Maybe you like medical profession more, so only such a question has come up. So definitely I would suggest that please come and join BNYs, any of the colleges all over India that is nearby to your state.
Yes.
Only thing is, even like last few days during this admission time, immediately after +2 result, even I used to get so many phone calls. And those who are little elderly, after marriage, if they opt for from other streams, after completing other streams, if they opt for BNYS, I say only one thing. So you have to get ready for long 5.5 years mentally. Prepare yourself mentally to spend 5.5 years further to earn something. So sometimes people just see that, oh, it's an alternative system, there is nothing much. But we have very clearly, our panelists today, we have very clearly explained, it starts from basic anatomy, 2 papers, theory and practical onwards, up to understanding understanding the depth of yogic philosophy, yogic psychology, and yogic research. Okay, it has a lot of like around 13, 14 subjects are equal to MBBS, same as MBBS textbooks we use in our curriculum, and the clinical practices, labs, all these things. So people have to spend 5.5 years completely dedicated for the study. And of course, our every day starts from morning 6 o'clock. People think that okay, they can
Yeah,
at least
definitely.
daytime they can utilize, but none
Yeah,
of
I
the
would
other.
like to add up.
Yeah,
5 o'clock.
Yeah, so many of such queries we often get, and we should be happy that people at age like middle age also they wish to study naturopathy and yoga. So previously I made it very clear there is no upper limit to study BNYS. So that is an open invitation. They can come and join our courses. But one
yes,
point that always I stress upon for such candidates, you have to attend the classes regularly as an 18-year-old. You cannot ask
yeah.
us for preferences. I have a job, I have a family to look around. No, nothing like that. If you can be very sincere in your curriculum, you are very much equal to the other young candidates who are studying BNYS. So that is some things that age is not the limit, but regularity in the classes is should be there. As Dr. Vibhas told, 6 o'clock or 6:30 we start our yoga. So definitely you have to be there from that time in the college campus. So all those things, if it is taken care, age is not a limit. Anyone can join BNYs after 17 years or 16 years, as Dr. Abhay had told.
Maybe
Yeah.
only the one
In some
medical
of the
course, right? Only one medical course
in
all over the world which start its first attendance at 5:30 or 6 o'clock. So always
Definitely.
we are
yes,
proud of that
yes,
curriculum for means
yes.
long 5.5 years in the adolescent period. Each student is getting trained to wake up early, uh, to have a proper lifestyle, to have the vegetarian food, sattvic food. So all this personally their own health. They are like when a parent is leaving a student to a yoga and naturopathy medical college, because they can assure at least their own students' health as a first benefit.
Absolutely. That is the first and the best benefit. Actually, the individual's health will first improve, and he will improve his family's health, and then later
Yeah.
he will serve the society. Just to add on to Dr. Jyoti's point, there are some universities which have admission policies that UG course will be up to this year age, PG course will be up to this age, or a what you call PhD will be up to this age, depending on the various UGC norms and other things. Some of the universities have their own admission policies. Such universities, there may be an age limit. Otherwise, rest of the thing is open as you spoke. But the commitment required for 5.5 years, because none of our BNYS colleges, I believe, do give any slack. Either it is in attendance or it is in the strict way of the academic involvement what the student has to put in for 5.5 years. We are very strict with that. That is very very clear in all the BNYS colleges, and that is why the commitment which is required for 5.5 years at that age would be much more than a younger boy who is just 16 or 17 years old. So if the elderly people want to choose also, it would be like you are welcome, but it would be a little difficult than thinking of doing that for 5.5 years. And there is in the Indian system again, I mean Indian society. After a certain age, you have to get married, you have to have children. There is a lot of this thing, and then the income matters and all that. So definitely you can think of, but decide before properly before jumping into. That's very important.
And to add on that, just one point is like the mental health or the mental and spiritual health, like the knowledge which imparts through the traditional yogic texts like Patanjali Yoga Sutra, Hatha Yoga Pradipika, Kherada Samhita, etc. in BNYS curriculum. So that gives, after all, maybe even if they are not going to the spiritual depth of it during the 5.5 years, later on it really benefit for a practitioner, and even to give some type of yogi counseling and other therapeutic management of each patient, all this traditional knowledge helps them very much, because nowadays everything is under psychoneuroimmunology concern, and basic management of manomaya kosha, etc., stress management. So these classical traditional knowledge of yogic textbooks also gives wonderful benefit for individual student. So I think we have covered almost everything regarding every aspect regarding the yoga and naturopathy medical education in India, starting from its history, its curriculum, syllabus, admission procedures, and higher studies, different options as a career. So regarding the scope of BNYS. So I think we can have a concluding remark from each of you, just one or two lines. I'll start from Apar first. Apar, Dr. Apar, can you please give your
Yeah,
comment?
I think like what we were talking today, this is the best way of going about integrative medicine, as well as to prevent, promote health, as well as manage health problems. And therefore, if you are interested in joining, a career which will help you to take opportunities in the areas that were discussed today, you are very much welcome to BNYS. There are 45 colleges, whichever is convenient to you. You can always come. This is a family that you would be joining of the yoga naturopathy physicians.
Okay. Dr. Jyoti, please, your comment, please.
Yeah, sure. So I want to suggest the candidates who are seeking for higher education after 12 that this is one of the course which is the demand is increasing day by day, because the awareness among public is increasing. They do not want to go into some system which may harm them in any of the way. So they want a system which can help them to lead a healthy lifestyle, to go and to treat the diseases, whatever conditions they may be having, through a drugless system of medicine. So this is the boom, that this is the time which is seeing the boom of drugless system of medicine, and naturopathy and yoga being a medical degree. So the same like other system of medicine like MBBS or Ayurveda, etc. So the boom is right here, right now. So I suggest the students who have an interest towards medical profession to think about this and choose this as a career which will give them a wonderful future. That is what I would suggest, and especially I will add upon being a woman. Please do not think otherwise. So I want to suggest that I have seen it in my academic career. Most of the students in any class taken in any of the colleges, 80 to 85% or 75% will be girls. So this have led to think that when I think about such thing, women are more or girls are more oriented to such system of medicine, because there is always a nature of serving or serving human life or something like that. So the number of girls who are taking admission in BNY's courses are a lot more than men. So it is an equal opportunity for both boys and girls, but girls do prefer such a course more than boys. So they can take up this course, and they are like Upper told, we all are here to clear any doubt regarding other after this talk show also. If there is any doubt, all of us are having our websites, our numbers are shown there. They can call us anytime and get any of the doubts cleared regarding admission in BNYS colleges.
Okay. Students, your final comment to the public also, Dr. Abhay, please.
Yes.
Whoever is
It was a
watching.
wonderful session today. Wonderful session. We have almost covered all the aspects of BNYS or naturopathy and yoga medical education, maybe post graduation, maybe undergraduate medical education, or even up to the doctoral levels. We have covered most aspects of what you call the various scope involved in these uh, therapies and what you call the system of medicine. What I would suggest the general public who is watching this is, again, it is in my 25 years of experience, there is no better job satisfaction than hearing from the patient. We have been cured. We have been free from all those problems what we had without even using a single drug. and that is the most satisfying thing which you will hear from a patient. And I have heard this, maybe all of us, the doctors sitting here, have heard the BMS doctors this appreciation from the patient, that I have gone to all the doctors, all the specialists, and then I came to you, or I came to your hospital, and here we found this solace without any medicine, without any drugs. Thank you very much. You have saved our lives. You have made us so healthy and energetic for our life, and that is the most satisfying thing what you will be able to listen to in your life. And for that, I think that satisfactory one line, I think we can sacrifice our whole life, not only this 5.5 years of BMS degree or something like that. The sense of service what we have as BMS graduates definitely comes up with a lot of name and fame, and then of course monetary benefits also. So the graduates need not worry that naturopathy and yoga is only not going to help. I mean, make them a lot of money or something like that. It also makes money. Don't worry. It's not very what you call. We are just not giving any medicine, so it doesn't mean that we do not earn. Also, we have good earnings, a lot of opportunities. As we were talking, it depends on the knowledge and skill of the BMS graduate. From 20,000 to 2 lakhs is the monthly package. Monthly package. I'm talking about monthly package from 20,000 to 2 lakhs, depending on his skills and his what you call. Yeah, I should also brief about this, because the general public should know what a BMS doctor would earn actually, because at the end of the day, that's what the future of the graduates is there. So 20,000 to 2 lakhs. Choice is yours. If you are coming into BMIS and then making yourself ready for that upper limit, then you will definitely get that. And I would simply suggest the students and parents, you need not search too many things. Just go to a Google page and type BNYS admission. You will get the information what is necessary. BNYS admission is what is required to be typed in Google what you call search bar, and depending on your area and other things, then you will get the options, and we are always there to help you. Don't worry, our numbers are on our websites, as Dr. Jyoti said. You can find our numbers, you can find our emails anywhere, and you are also welcome to visit all our colleges to see, like Dr. Jyoti, Dr. Vibhas, Dr. Apar, and me are all from colleges. You are always welcome. If you just want to see and understand our system of medicine, you are always welcome. There are about 45 to 50 colleges in India. Anywhere nearby your colleges and nearby your place, you may get a college. Please visit them, understand about naturopathy and yoga. And I sincerely say that you can adopt some part of lifestyle modification, naturopathy and yoga into your life, so that you can have better health in your life. They are very simple methods. You can contact any of one of the BMS doctors and understand them, and do please have a healthy life. Stay safe. Thank you. Thank you, Enigma, and also Ayush Connect, as well as Healthink Tatastu, who have given us this opportunity. I think on behalf of Dr. Apar and Dr. Jyoti, I can thank all of you people who have done this wonderful job. Wonderful job. Dr. Vibhas, thank you very much for being a great host also today.
Thank you, Dr. Abhay. That's a very good conclusion. Especially there are a lot of feedback regarding today's webinar by giving their appreciations. Also, all the audience can wait for next Sunday. We'll be back with Ayush Connect program along with Healthink and Enigma regarding various other aspects of yoga and naturopathy field. Today we have covered the yoga and naturopathy medical education in India. Thank you all the viewers, all the panelists, and thank you Healthink and Enigma Central office bearers. Thank you everyone.